Hi, my name's Christy Call, editorial director of Cure Magazine, the indispensable guide to every stage of the cancer experience. It's my pleasure to be joined with Dr. Klemp today so that we can kind of recap what everybody has talked about today and kind of go over the highlights that everybody's learned. So before we get into some of my questions, Jennifer, we actually have a question from the audience. It says, I am a nurse practitioner leading a breast cancer navigation program. I would love your input and experience of advanced care providers taking on navigation roles with regards to care and reimbursement.
Mhm. So that question is a great question. And I think it's important to think about advancing APP roles in general. And as I think about APPs and their need, not really to subspecialize, but to have those concentrations that bring uniqueness to their role, whether it be navigation, whether it be genetics, survivorship, there are real ways to strengthen that expertise. And I think navigation, because it is built in as an integral part to a lot of the alternative payment models and so much of where we're going in healthcare, that I think that that can be a real advantage to taking on some of those roles because the APP is a billable provider. And so by taking the reimbursable pieces that are embedded within navigation that right now we don't get paid for, I think that that could be a real strength and advantage to the organization and to the patients that you're serving.
Great. Yeah. And so I kind of want to go back a little bit to this morning. So Dr. Borgen had mentioned that there were 4 things that we've learned from COVID so far. So what do you think is the one main aspect that we've learned from COVID as patient navigators?
Right. So Dr. Borgen had a lot of insight. And I think the thing that, when I wrote and took my notes from his talk, a lot of it obviously was about the power of transmission and a lot about sort of where we need to rapidly go based on the fact that this is, this is a unique and pretty aggressive virus that we're dealing with. It's unlike others that have come before it. So I think that the part that was important for navigation to take out of that is that geographically where we do see these differences, whether it's what we see in the Northeast or the Southeast, which are different and different peaks, and when we are seeing exposures and preparing for kind of this next round, I think the important part for navigators is that pay attention to what we've just done. Let's learn from what worked and start preparing in our conversations for these potential next waves, because the reinforcement, the expectation management for both ourselves, our staff, our patients will really be helpful, as this does not seem to be something that's going to stop tomorrow. It's going to have a prolonged life, and let's use the lessons learned to help empower us for the next wave.
Definitely. And so, in cancer, we talk with a lot of patients and caregivers about the fact that a cancer diagnosis can be this new normal. But, with the pandemic, I think we are all facing a new normal now across the nation. And, in Karen, Linda, and Donna's talk that they had earlier this morning as well, they mentioned ways to kind of implement different strategies into their daily practice and how that's changed for them. So what are you hoping are the key takeaways for navigators to take away from this new reality so that they can start implementing different strategies into their day-to-day?
Yeah, I really liked that session, and I felt like we had a lot of great insight from pretty innovative people that are also practical, right? So you need innovation and practicality together to really make some solutions. So I think we need to, some of the lessons from Karen that I took away, we need to be surveying really our teams as well as our patients to what they can and can't do. Are they prepared or not prepared? And address those lingering issues. Technology is new for a majority of our patients in this capacity. So how do we build those kind of quick start guides and help them, whether it's a minute and a half YouTube video that their grandkid can help show them, how do we help them leverage technology, because that's not going going away? And then how do we really continue to provide professional education and push in a bidirectional, really sort of conversation what is needed, and then how do we push that professional education out to the field? And there really needs to be an ongoing, not only repository, but ability to have that real-time, what you need to know kind of conversation that happens every day and is relevant, not here's the update for today, but here's what you need to know to help you do your job today.
Mm-hmm. Definitely. And so I know you and Nicholas had also mentioned the fact that compassion fatigue and burnout is very real. And I can only imagine that during the pandemic, it's even more real than usual. So how can the navigation tool and the Academy of Medicine's toolkit address this navigator fatigue and burnout?
I think one of the biggest things it can do is brings organizational awareness, right? So I think that, you know, a lot of times people will talk about issues, but they don't necessarily embrace or understand what the full scope of that is. In our town halls, I know at the University of Kansas Cancer Center, some of our leadership have been pretty candid with challenges that they've had. So that personalization, which we don't use very often, you kind of use it sparingly as needed, kind of PRN. That personalization could be really helpful, because how do you get the organization on board, which needs to support the staff and the people working from home and the people who are coming in and exposing themselves and their families? So I think that if nothing else, we need more organizational awareness, and I'm hoping that some of those tools can really bring the evidence that's required for organizations to see this as a problem and to hopefully support, not just by acknowledgement, but in action of preventing compassion fatigue and burnout.
Absolutely. And so kind of in line with, you know, the pandemic and, you know, there's been this advancement in technology over the last few months, just with telemedicine and patients learning how to use telemedicine. And I know Nancy had spoke earlier about technology. So with that, how far would you say we've come with technology in breast cancer care, and what do we have to look forward to as patient navigators?
Technology has like accelerated like a rocket ship, right? So I've seen organizations that had like 18, 24-month plans deploy them in 2 weeks. So it has been, you know, trial by fire. So the reality is that's not going away. And I think that we need to, number one, really streamline our utilization of technology. I am burnt out in the sense of being on Zoom for like 7 hours a day. So that's not, you know, that's not healthy either. So we need to figure out that the balance of using technology. We need to figure out the security of technology. We need to empower our aging workforce in oncology. And aging, I don't, you know, that's relative, but the fact is that not everybody is good with technology. So how do we kind of streamline some of the onboarding and quick start so that people don't feel so overwhelmed and shut down, or the workforce we do have says, to heck with this, I'm done, I can't do anything, this is just, it's too much, which is also happening. So I think technology can help us. It also, though, has caused part of the infodemic, right? There's so much information. Where do we go? How do we know that it's reliable? We did a cancer and COVID echo series in April, and one of the sessions we covered the infodemic of COVID, and that, you know, there's 700% increases in fact checking, and, you know, so much is happening, but how does an average person or an average healthcare worker keep up with what they should and shouldn't know? So I think we need to develop some digestible information that is reliable, because just too much out there. So technology overload is a concern, but technology is essential. So we need to do a cost benefit, kind of get the teeter-totter back in check, and figure out how to support the workforce and our patients as we continue to utilize technology more and more.
Right, definitely. So we actually have another question from the audience. Dr. Klemp, what influenced you to go into patient navigation, and what would you suggest to people who are considering going into this field?
So I, by trade, am not a navigator. I function in a role of supporting navigation and have navigated and have hired navigators. So I'm like I've grown in the process. But I will tell you a funny story, which I normally don't. I don't normally personalize. But my mother was diagnosed with breast cancer back in 1994 when I was graduating from college and going to med school. And the interesting part is that she was one of those people who had a bone marrow transplant for her breast cancer. So I had lived through that, and I was her personal, caregiver who took off time, and that was my ROI, is being with my mom. So when I was done with the acute part of the journey, I wrote my mentor, a breast medical oncologist at KU, a letter, and I described the role of a navigator. She still has this letter, and I described it to the T. It didn't exist at that time, but I said, this is what we need for patients going through this intense type of journey. And it wasn't just for transplant, it was just cancer in general. And so, I've disclaimed multiple times that I play one on TV. So I'm not playing a navigator on TV, but I have been in oncology for 25 years, filling a lot of those roles and supporting that need, and hired one of the first survivorship navigators in the country back in the mid-2000s. So I think that the important part about what motivates us to either fill a role, support a role, or be part of that team is that I do believe in team medicine and team science. And I believe that navigation, if any of you have ever seen the continuum of care map that I use as integral as part of my philosophy, navigation is the first piece, and it continues through the entire cancer journey. So, I would like to say that navigation is a core of my philosophy, and that it's part of what I believe is how we achieve really better outcomes, better patient care, and better quality and quantity of life for our patients living with cancer.
Definitely.
Long answer. I'm very sorry.
So I want to shift gears back a little bit from the session this morning, how we can become whole. So Dr. Newman had discussed the racial disparities to having equal access to cancer care. How can we work to negate these disparities and help patients, navigate their care? And moreover, are there any resources that we can offer to help bridge this gap?
Great. Dr. Newman did a very beautiful job, even using some analogies like the Titanic and showing, access to care and those barriers that we need to tackle. We also, on the flip side of that conversation, had the CDC sitting there with programs like the Early Detection Works and screening breast cancer and cervical cancer screening programs. Most of the states that I interact with are underutilizing those types of screening programs. So how do we empower our local safety net clinics or community providers, primary care, to know about how to use some of those programs to get patients in for screening? My colleagues and I in Kansas are working on developing a program not only to empower local primary care, local family practice, and our safety net clinics and our early detection work clinics is what we call it. But how do they utilize risk stratified screening? So when do they start screening? How often do they screen? Because there are some conflicting messaging depending on if you're getting screening recommendations from your professional organization or from the U.S. Preventive Task Force. So I think the important part is that we need to better utilize existing programs. We need to identify where those gaps are and where the limitations are. And I think navigation can really help us fill in those gaps. But I always hate to build new things until we fully utilize the existing programs and services that we have. And I do think that many of those are underutilized because people don't know about them, people don't know how to access them, and they don't know how to use a lot of those programs that are out there.
Mm-hmm. And so during that same session, Dr. Farley had discussed, integrating community health workers and navigators into the plan of care. So at CARE, we talk a lot about the multidisciplinary approach. So how can we help patient navigators make sure that they're integrating themselves into the multidisciplinary approach to cancer care?
So I think that from that first touch point of the community health worker being in the community, they can match patients to those resources. They can be the conduit that a busy primary care or safety net clinic who doesn't navigate that process well, they have a resource to help them help their patients access that resource. So I think that by us utilizing community health workers to understand and maximize those opportunities, to have us as providers be able to pull those types of individuals into our seminars, our discussions, our trainings would be ideal, because then you're bringing, like you talked about, that multidisciplinary approach, but the circle of care has to all be informed and know how to communicate as well. And if we don't sort of foster the circle of care, then it will always be fragmented. So I think we need to bring in that entire family that's caring for that patient into the picture before we're going to really be able to maximize and leverage all those existing resources.
Mm-hmm. So I think we're just almost out of time. So I guess to just bring it all together, we heard it from a lot of individuals today, and I think we've learned a lot of useful information. So what do you think is next, and where do we go from here for patient navigators?
I think in kind of summarizing the themes for today, there's some common threads, obviously, of education, scope of practice, the lanes that are filled, but there's also the need to come together to have these discussions to continue the conversation, because there are going to be speed bumps in the road, right? So we're in a lane, but the speed bumps occur, and that could be COVID-19. It could be changes in someone's insurance status. There's lots of barriers that happen, and we have to be able to pivot as a healthcare delivery system, as patients. And so my two biggest sort of common themes that I took away from today are that we need to be better at having expectation management, being sort of transparent with roles, responsibilities, expectations. And then the other part of that is we do need to work on how we communicate and utilize that team and those resources. So expectations, priorities, transparency, and then leveraging what's currently there so that we can identify those gaps and then work towards that common goal of standardization, accreditation, reimbursement, which is really the next tier up. We have to kind of continue working on this tier before we can go to the next tier. So I think that we have a lot of work to do, but we have a lot of key stakeholders, and bringing them together, thanks to CURE, thanks to Susan G. Komen, Greater NYC. These are ways that we continue that conversation. So thanks to you all today and for this opportunity.
Yes, thank you as well.